Hello community, we are happy to be coming to you today to talk to you about our elective services resuming at Duncan Regional and at Jefferson County. The last 4 to 6 weeks has been definitely a difficult time for not only our hospitals but our entire community. I am happy to report that beginning Monday you will see all of our services back, and we are slowly starting to ramp them up. We're in a different world than we were when this pandemic started, and so there's many things that we have to do to be cautious and also to remain safe and to keep not just our community safe but our team members and patients that are going to be there seeking our care. I want you to know that our hospital is open and we are here to provide your health care needs, and that has not changed and will not change. We've taken many steps to ensure that people's safety is protected. With these, one of the things that won't change is the hospital is still closed to the community as far as being a place to come in and to eat in our cafe or to shop at our gift shop or to even visit patients that are admitted to the hospital. That is all part of the governor's order, but it's also an abundance of caution to make sure that we continue to do what we can to socially distance. That remains the one thing we have to defeat the COVID-19 virus is all of us wearing masks and all of us staying 6 feet apart. And so I hope that you'll join me in those efforts as we continue to work with everyone to keep this virus out of Stevens County. I am really happy to say that we have not, our last discharge for a positive COVID-19 patient was on April 3rd. We only had 2 to begin with. It's the most we ever had at one time and in total. And we see our daily infection rates continue to decline. In fact, I think today is our 18th day of decline. So I think we're in a very good place in Stevens and Jefferson County. So with that, I want to turn it over to Kristen Webb, our Chief Nursing Officer, to talk about some of the specifics around what this looks like if we begin our elective surgeries and procedures.
So our surgeons and surgery team are very excited to get back to their normal work of taking care of surgical patients. But we are opening very cautiously. Our surgeons are they're going through their patient list for those who have been waiting to have an elective procedure, and they are using a criteria to determine those patients that we can bring on in now, or those patients who, for their safety, should wait maybe a few more weeks. That criteria includes things like how at risk the patient is if they developed the COVID-19 virus infection, how at risk they would be from having bad outcome related to that, as well as with the surgery, at post-surgery, would the patient have to remain in the hospital more than a day, and also just if the outpatient non-operative treatment that's ongoing right now is effective and that the patient could wait a little longer. We are requiring that all operating room procedure patients have a COVID-19 testing prior to their procedure. The patient will be notified of a time to come in a few days before their scheduled procedure. They'll just drive in to the AOS area, and one of our nurses will meet them at their vehicle and collect the sample for the test and send that off. We do ask that the patient remain quarantined at home from the time they get their test to the time that they come in for their procedure. One of the other reasons, besides safety of patients and staff, that we stopped doing elective surgery back in March was the PPE supply. Unfortunately, masks and gowns still are not able to be purchased as readily as we would like them to be or need them to be, so we are monitoring that inventory very closely as we begin to start our elective surgeries back. For that reason, we are asking patients and their one guest that comes with them to bring their own face covering, a cloth mask or other face covering to wear. We ask everybody that's in our facility, from our staff and physicians as well as patients and any guests, to continue to wear their face mask while they're in our facilities. The visitor, the guest that comes with the patient, will be allowed to wait with the patient in their private room for their procedure to begin. If at any time the visitor is unable to stay in the private room with the patient, we're asking them to go back out to their vehicle to wait. We're keeping our waiting rooms closed at this time so we can practice social distancing and keep everyone safe as we begin. We also, our cafe and gift shop and Chick-fil-A still are closed, but there is a vending machine, and the visitor is able to get to that vending machine and utilize that if they need to.
I think one thing I'd like for the community to know is, as we continue through this pandemic, the thing that is, I think we often lose sight of is we have one treatment for this virus, and that's social distancing. There's no medications for this virus yet that is proven to be effective. We do not have a vaccine for the virus yet. And until those two things happen, I don't see us coming back to a state of normal, at least the normal that we all appreciated prior to the pandemic. So with that, I can't say enough how much I want to encourage our community to maintain, when you're outside of your home, maintain 6 feet from everyone you come in contact with. And then to also, if you're going to be inside a building, you should wear a mask. Those are the principles that we're applying here at the hospital. And you'll see all of us with those while we're here, but hopefully we'll all see each other in the community wearing those as well, as we do what we can to keep the virus out of Stevens and Jefferson County. So thank you for listening to us today.